Tens of thousands of people in Maine lost their enhanced premium tax credits when the federal government cut Affordable Care Act subsidies. So that meant fewer Mainers enrolled in the state's health insurance marketplace.
So this morning, gubernatorial candidates telling healthcare leaders how they would fix the problem. Political reporter Jackie Mundry was in Augusta for the conversation.
Healthcare remains front of mind for many Mainers and many candidates, whether it be the healthcare workforce, its costs, or its innovation. This morning, 9 candidates for governor had a discussion on this very topic.
My doctor sees me for 5 minutes and they have 5 hours worth of billing. Maybe I'm exaggerating a little bit, but we want to make sure that they're actually spending time with the patients and not wasting a lot of time on paperwork.
So as governor, I'm going to increase operating support directly to primary care and our rural hospitals, paid for through my economic plan.
Really have to work on the rural communities and make it attractive for folks to invest there and make their lives there.
Our system is not working as it should. We need to reform our system of government, and then we can go from there and actually spend the money hopefully where it should be spent.
Candidates making their pitch to state healthcare leaders, with about half of them saying they support a piece of legislation sponsored by Troy Jackson when he was in the legislature that would begin to address the pharmacy deserts across the state.
Last session, I sponsored a bill to put $6 million into allowing FQHCs to help with their pharmaceuticals. But what happened, the administration didn't want to fund it.
It is a great step in that direction. I've heard from providers who say that in rural areas, chain pharmacies have closed, the independent pharmacies have long closed, and this option of having community health centers provide pharmacy is excellent.
It's a smart investment that would help CHCs expand pharmacy services, particularly in underserved areas. And as you all know, in a lot of rural communities, health centers are the most reliable, if not the only way to keep that access.
We told you about this bill last year. It is now a $3.5 million investment that the Maine Primary Care Association is lobbying for.
It was great to hear that level of support and that acknowledgement of the pharmacy access issue.
The panel was made up of mostly Democrats and independent candidates, with just one Republican, Jonathan Bush, who says Maine needs to innovate in the healthcare space.
We could also blue sky our licensure. If you come to Maine as a social worker, you got to go back through your entire social work process again. Same thing with doctors. These are all self-inflicted wounds out of Augusta.
The June 9th primaries are set. There are 5 Democrats and 8 Republicans who have made the ballots. In Augusta, I'm Jackie Mundry for Maine's Total Coverage.